Then Professor Yunus got interested in extending the same concept of microfinancing to healthcare for the poorest of the poor in a very, very low cost manner. Professor Yunus is interested in collaboration with Mayo Clinic, which is a tertiary advanced healthcare, to see if we can partner together to make this happen in a bigger way. We got excited about it when he asked us to collaborate with him. And our main interest in this, besides giving the technology, the expertise in every aspect of healthcare that we have, is to learn how this is being successfully done in a very low cost, sustainable manner, because then we want to bring it back to the United States. And even in the US, as you know, there are several millions of people who are really underprivileged, not having enough money, not having health insurance, and maybe we should use that to help these people here. So that's how this collaboration has started. What we thought is that before we really take it in any big manner, we wanted to do an initial pilot project, which is not expensive, simple, and it gives us an opportunity to get to know about the team there and demonstrate that we can do something, and then use that as a stepping stone for bigger projects to follow. And we have already written a very small pilot project where we take one Grameen Kalyan clinic in a small town or a village, and we identify a target group of population who are participating in the Grameen Health Scheme there, say between ages 15 to 55 or something like that, and screen them for intestinal parasitic infestation like hookworm and roundworm, which are very prevalent in that part of the world. It just takes one stool examination, very inexpensive. We can even, the healthcare people can go to the homes of the people instead of the people coming to the clinic, collect the stool sample. The step 2 is identify those people who are positive for hookworm and roundworm, and then go back to their homes and give just one tablet, which is the treatment. Supervised treatment. That means you give the tablet, stand there and make sure they take the tablet. Step 3, after a couple of weeks, go back and collect the sample and see if the parasites have been eradicated, because this is supposed to be a 90% success rate. So it involves 3 visits, 2 stool examinations, 1 tablet. Not expensive. It will tell us some ideas about the prevalence of the infestation by these parasites in that part of the world. It will tell us about the compliance of the population to such interventions. It will also tell us about what's the efficacy of that such a low-cost intervention for a common problem. And it will make us more familiar about working with the team there so that we can take this to the next level. So once we finish the pilot project, we are trying to tentatively put this whole experience and collaboration into some phases, like phase 1, phase 2, phase 3. So the initial pilot project would be probably phase 1. And if we succeed in that and we have a good working understanding with the team, then the next phase 2 would be happening both in Bangladesh as well as in the US. In Bangladesh, we may come up with more projects which are slightly more complicated than this, where our input for the various aspects like quality control, information technology, and the nursing expertise that is required, and making various web-based learning tools available for them, like Ask the Mayo Expert and enterprise learning system that we are experts at. That's going to happen in Bangladesh. And I think at this point of time, what really fascinates me and the team that are working with me is the passion that is there from both sides, Grameen side, right from Professor Yunus down to various people we have talked in the last few weeks, and right from our CEO, Dr. Cortez, who had actually held discussions with Professor Yunus, to each one of us who are involved in this. Everybody is extremely passionate. We think we will work hard to make this a real long-term collaboration with the ultimate noble goal of making healthcare available to underprivileged populations in a very low cost but yet sustainable. And this concept of social business, which Professor Yunus has made it popular all over the world, now it's the buzzword, is where you make profits but invest the profits back into the society for the society's well-being. Well, in a way, this is not very different from what Mayo brothers have actually thought about many, many decades ago when they started the Mayo Clinic. What they did was group practice, get all the money, but instead of giving money to each individual person, invest in the institution so everybody gets benefited. Not only the people who are working for the institution, but also the folks who come here as customers. So in a way, we have been doing something like a social business for decades, and now we are doing with social business experts from a different part of the world, and this fusion is going to be fantastic.